Thank you, Andy. Thank you all for allowing me to join you all today and share a brief update of what we're seeing on the front lines with COVID-19. 1 year ago, we came to you and discussed what we were seeing. What we were seeing is an enemy from without that we couldn't see, a virus affecting those who were older, who had comorbidities, chronic illnesses, and having devastating effects, hospitalization and death. Today that no longer holds true. The virus is no longer drawing that distinction. We're seeing far more young people affected by this virus, requiring hospitalization, suffering devastating injuries such as lifelong injuries to their lungs, as well as strokes and heart attacks. What we're seeing is the virus no longer makes a distinction based on illness, based on age, or even ethnicity. What we're seeing is the virus is drawing a distinction between those who have been vaccinated and who are unvaccinated. Our hospitals are once again filling up. They're filling up with young people and old people and those with comorbidities who have not been vaccinated. Over 90%, 92% of our hospitalized patients are unvaccinated, including those in our ICUs. 60% of our ICU patients are those who are unvaccinated and have COVID-19. This is a huge numbers, and we're seeing this peak rise very, very quickly, rising to match or exceed the peaks we saw in the winter months of December and January. But there's hope. There's things that we can do as a community once again to come together to combat this enemy from without. This is not an enemy of vaccinated versus unvaccinated. This is an enemy of that we can't see any longer. We can't feel, we can't smell, but it is something we can do together. We can continue our fight to prevent this by doing all the safety measures that we've talked about, wearing our mask, watching our distance and washing our hands, staying home if we're ill, getting tested and screened if we've been exposed or have illnesses that are consistent with COVID-19. And we can get vaccinated. The vaccines have been proven safe and effective at reducing not only infection, but also if infected, and we're seeing that, but if infected, reducing the need for hospitalization and ICU stay. But the communities can continue to do other things to prevent and combat this surge that we're seeing within our hospitals. And those includes avoiding risk-taking behaviors, staying healthy, getting sleep, eating well, exercising, managing your chronic illnesses well. And certainly being mindful of the large gatherings, being mindful of those who may be more vulnerable in our society. So these things we can do to combat this enemy from without. I want to continue to encourage everyone today to listen to the message you're going to hear from my distinguished colleagues from 5 other institutions here. And I want to thank you for your time today.